Hello, and welcome to my video about safe sterilization work practice. My name is Justine Enriquez, and I am here to introduce you to the 4 different reprocessing cycle in the Sterile Services Department. Sterile Services Department is where reusable medical devices are correctly cleaned and disinfected, inspected, and sterilized. Sterile Services Department is divided into 3 areas, which are the decontamination area, inspection and sterilization area, and the storage area. These areas are separated to prevent cross-contamination during the reprocessing cycle. Sterile Services technicians are specially trained to ensure that these processes are done correctly. This is to ensure instruments can be safely used for the next patient without risk of transmission of infectious microorganisms. Processing used instruments starts at the decontamination area. This is where reusable medical devices used from surgery are thoroughly cleaned. As a sterile services technician, we begin by wearing an appropriate personal protective equipment or PPE, such as hats, shoes, a face or eye shield, mask, gloves, and gown. This is to protect us from hazards and bacteria or viruses present on the dirty instruments. It is very important to wear an appropriate PPE, especially in the contamination area, because unlike the inspection and storage rooms, which are clean, we come into close contact with soiled instruments. These medical devices potentially carry microorganisms and infectious diseases. We start the reprocessing cycle by receiving dirty equipment in the decontamination area. Here, we clean, sort, and disinfect reusable instruments, equipment, and supplies. When we receive trolleys of dirty instruments, we unload them on the trolley and place them next to the sink area. Remember to push trolleys to minimize risk of injuries. We place them near the sink to avoid carrying heavy equipment and for safe handling. Cleaning starts with sorting instruments depending on which area they would go or what cleaning process they would undergo. There are 2 kinds of cleaning process. One is manual cleaning, which involves the use of correct dilution of detergent in the hot water. Manual handling is done on instruments that are delicate or power surgical instruments. In this video, I will be showing the other cleaning process, which is the mechanical cleaning. Here, I have plastic set. I start by soaking the instrument in the water with detergent. This would help remove debris, especially if the set that was used were very soiled or bloody. We then open and dismantle them on the tray for thorough cleaning. We put the sharps on separate small trays to avoid injuries when handling them. Since all instruments are part of one set, we put tags of the same color on the trays so the person on the other side can identify them. I will then scan the manifold to the T-Dock tracking system and load it to the conveyor and start instrument cycle. When cleaning process is finished, always follow the proper doffing of PPE.